As more states expand access to Medicaid, some South Carolina lawmakers are pushing to examine the program's pros and cons.
News 19's Becky Buds has those details.
South Carolina remains among the 10 states that have not expanded Medicaid coverage to cover people living below the federal poverty line. Now, one Republican lawmaker says it's time to at least consider it.
We are lurching towards single-payer coverage. We're lurching towards single-payer care if we don't do something to improve healthcare markets. So that's why this is so important.
Senator Tom Davis is leading the effort to create a legislative committee dedicated to improving healthcare access in South Carolina.
This proviso is meant to do, to step back and take a 40,000-foot look at healthcare markets and figuring out how do we increase supply and empower demand.
Davis says the proposed committee would explore increasing the number of physicians, lowering drug prices, relieving medical debt, and possibly expanding Medicaid. The committee would be required to report its recommendations by December 1st. Davis tells me he's neither for nor against Medicaid expansion.
It's important that we go ahead and have an open mind on everything, that we put all the facts on the table, we have an honest discussion. We owe that to the people of South Carolina.
Even if the committee recommends expansion, it faces an uphill climb in the Republican-dominated legislature. Governor Henry McMaster's spokesman telling News 19 in a statement, quote, Governor McMaster does not believe that Medicaid expansion needs to be studied. Rather than obligating future generations of South Carolina taxpayers to pay hundreds of millions of dollars in additional costs, the state's emphasis should be on reducing poverty and expanding prosperity, thereby reducing the need for Medicaid assistance. Regardless, advocates like Sue Berkowitz with the South Carolina Appleseed Legal Justice Center say it's a step in the right direction.
Because this is going to be the first time we would ever be looking at everything holistically. I'm under no delusions that this means it's going to happen, but I would be so grateful if we can do a real look at all aspects of how we provide health care in South Carolina and how we can do better by people.
The proviso still needs final approval in upcoming budget negotiations, but Davis tells me he's optimistic the House will decide to keep it. Reporting at the State House, Becky Buds, News 19 WLTX.
More than 1 million South